My name is Randy Bigley. Joining me on the podcast right now from ADAMH is Brad DeCamp. Hello, Brad.
Randy, how are you today?
I'm doing well. It's good to see you.
Good to see you too. Good to see you too.
We got a couple things happening this month, right? What do we have?
Yeah, we do. We have May is Mental Health Month,
Yeah.
and so this is a big opportunity for us to talk about mental health issues related to that, depression, anxiety. We have been doing a lot of work around trauma education as well, and May is also Trauma Awareness Month.
Okay.
And so this is a really good time for us to talk about mental health and different issues that surround that. And one of the things that I've been thinking about is with the recent pandemic, there's statistics that say that 1 of 5 people over their lifetime will deal with a significant mental health issue, but we also know that 5 of us have mental health. And we've all been exposed to additional stress throughout the pandemic in different ways. So it's important to be talking about this, to talk about issues, talk about them openly, and to recognize it's okay to ask for help.
You know, and a lot of people lost family members or friends during this whole thing, this pandemic.
Absolutely. So just the normal grieving process that we've been used to going through was very different. And so we want to figure out how we can be there and support those individuals who need help.
Sure. And the stigma of mental health, I think we need to get over that. I mean, I consider that the same thing as having a physical handicap, or I don't know if you use the word handicap anymore. Physical issues. I think there's such a stigma with mental health, and I don't think there should be, because, you know, it's more common than what you think. There's more people that have issues going on than what we realize.
Well, the mind and the body aren't separate; they're together.
Right.
And so I think you make a really great point, because we shouldn't be separating those. It should be okay, certainly, to talk about it. And that's one of the things that kind of struck with me with a former doctor that I work with some of my previous work, was just that concept that, you know, if you have this mental health issue, that's really no different. And we also know that people who have significant mental health issues also are likely to develop other chronic health conditions like diabetes and COPD and things like that. So it's important to try to figure out how we can identify early and maybe also work more closely with healthcare to help identify early as well.
So we figured they're all kind of interconnected, right?
Absolutely.
Yeah.
That's it,
Yeah.
yes.
I think they're like I said, they're discovering more and more about this as time goes on here, right?
I think so, and it's definitely you know, something that that people, I think, maybe a little bit more exposed to now, just again because of the heightened stress. But it's certainly something that, like you said, there's no reason to be ashamed. I understand why certain people would feel that way and not want to talk about it. And I think as, you know, society, we kind of, you know, pull ourselves up by our bootstraps and have that mentality.
Sure.
But some people are not able to do that, so it's okay to reach out to the helpers.
You see a lot of depression and stuff these days, I've noticed. I think that's unfortunately on the rise. I really do. Or maybe just more people are coming out about it. I don't know.
It could be both.
Yeah.
I think that we do see some more willingness to talk about it, which is, I think, a good thing. But I think we also have to be prepared to help people who come to us and say, "Hey, I need help."
Yeah. And how do they do that? How can they come to ADAMH?
Absolutely. So I'll talk a little bit about something else that's coming up, which is the 988 number, and that started off originally as a new suicide prevention number, but it's actually been expanded to crisis services.
Okay.
So the good news for our area in both Marion and Crawford counties is that we have a vendor that we've had a relationship with for about 3 years now. It's Pathways of Central Ohio. And they meet all the credentials that the federal government says that a call center has to have. So they'll be working with us to provide the 988 number. And the reason that's important is because in some call centers across the state of Ohio, someone may be calling in from another county or another region into this call center, and so that call center may not be as familiar with the local resources as it would if it was a local system. So with us, it's going to be someone that we've been working with locally for a few years now, at least. So we do have at least that coming forward. We also have our contact number, Contact Crawford County, which is 419-562-9010. People can call that. And we also offer a crisis text line, which is a free service. We actually see a lot of younger individuals use this service with the texting. You text the number 4 and the word HOPE to 741-741. And these are services that are more crisis oriented, but certainly people can call Pathways. They can call ADAMH at 419-562-7288, and we are happy to talk to people about different issues.
Just let people know there is help and resources out there for you.
Absolutely.
Yeah.
Absolutely.
You have to do it. You don't have to go through it alone, right?
No. We do have some other programs that we're working on with our neighbors in Delaware Morrow County. We have a team that we're putting together of volunteers to engage people who have maybe lost a loved one due to death by suicide. And so that's something that we feel very strongly about how we can support and engage those family members. So yeah, that's something that we're putting together as well, and we hope to have up and ready maybe here in a few months.
Wow. Not only National Mental Health Month, what else? There's something else too, right?
Yeah, we do have the Trauma Awareness Month. We continue to provide some training and education around trauma and the impact that it has on both mental health and addiction services. We're also doing some suicide prevention training. We have a couple models that we've been working on for local businesses, so we want to encourage businesses to, again, talk openly about this. We have a 1-hour course called QPR, which stands for Question, Persuade, Refer. That can be completed by people who've been trained locally to do that. We also have kind of a specific business set type of training, which is called Open Minds. It's a little bit longer, but it's still only 2 hours, and again, we can provide that locally as well.
Wow, a lot of services available.
I think so.
Yeah.
I mean, we want to make sure that we can get people in once they need counseling and things like that. But what we're trying to do is a lot of heavy work on the front end with prevention to make sure we're identifying and trying to intervene as quickly as we can.
Now you service Marion and Crawford County, correct?
Yes, we do.
Yeah.
Yeah.
And if someone, how do they, like you said, 988, can they get a hold of ADAMH directly, or?
Yeah, they can contact ADAMH directly. We're actually working on our phone system so we can roll the Marion and Crawford number into a rollover. So the Marion number is 740-387-8531, and Crawford is 419-562-7288. So again, we're kind of trying to roll. We want to keep the numbers separate, but they roll into one so that they can be answered and addressed. And then we have the numbers with Pathways in Marion. It's the old care line, which is 740-387-2273. And then we use the 800 number in Crawford, which is 800-544-1601.
Yeah. Anything else you got to add that we haven't talked about?
The only thing I wanted to mention is that we do have a suicide prevention coalition in Crawford County that's been around for many years, and so we're looking at maybe doing a refresh of that. We have a good partnership with the Suicide Prevention Foundation at the state level, and so they're good to provide training and technical assistance, and so we'll reach out to them, and certainly we'll notify the community once that's up and ready.
Like we said, there's help available out there.
There is, and we need to talk about it.
Or exactly, 988 is the number to call for
as of July 1. Yes,
as of July 1st, it will be okay.
Yes, it will. Yeah.
So instead of call 911, it's 988. Same kind of
that's
deal.
right.
Brad, thank you so much for coming in today. I really appreciate it.
Randy, it's always a pleasure.
Thank you.
Yeah.